How the Ears Hear and Possible Disorders by Kayla Oliva. The ear's purpose. The ears control how humans hear and perceive sound at various intensities and frequencies. Our ears are used in various aspects of our life, including enjoying music, following directions, hearing a child cry, in an everyday conversation. This ability plays a fundamental and extremely intricate role in how hearing works overall and can only be understood when broken down from the beginning to the end of the sound interpretation process. So to do this, first I'm going to go over some vocab words that are associated with hearing. So first is intensity and pitch. Intensity can be defined as the perceived loudness of a particular sound. Intensity is measured in decibels. Pitch can be defined as how high a sound is and is measured by the frequency of a sound wave. Frequency is measured in hertz. The human ear can hear sounds of various pitches and frequencies. We can hear frequencies from 20 hertz all the way to 20,000 hertz. For example, the human ear can hear something as soft and quiet as the wind blowing on a calm day, or as loud and intense as a firework display. Anatomy of the ear and its purpose in interpreting sound. The process of hearing sound, producing sound, and interpreting sound is strictly a scientific process. The visible part of the ear is called the auricle or pinna. The pinna collects sound vibrations to be interpreted by the ears. These sound vibrations then travel through the auditory meatus, a tube-like region. The vibrations then travel through the auditory meatus to the tympanic membrane. The tympanic membrane, more commonly known as the eardrum, then vibrates from the sound waves, which cause the ossicles to move. The ossicles are made up of 3 bones in the middle ear, the malleus, incus, and stapes. These 3 bones can also be known as the hammer, anvil, and stirrup. The movement of these 3 ossicles cause the fluid and the tiny hair cells known as cilia in the cochlea, which is in the inner ear, to move. This movement of the hair cells trigger electrical signals that then get picked up by the auditory nerve. The auditory nerve's purpose is to then send these electrical signals to the brain, which is when the brain interprets these electrical signals as sound. This is a picture that you can more clearly see the anatomy of the ear. The outermost region, which is the pinna, the auditory canal, all the malleus, incus, and stapes. Now these are some threats to hearing. There are a number of things that could threaten hearing, such as disorders, conditions, or diseases. These threats could affect, prohibit, and lessen the clarity of sound. So for example, if you've ever been to a very loud concert, that loud noise over a long period of time could lead to damage and the loss of that cilia, or those hair cells within the ear. And these hair cells are non-regenerative, which means once they go away, they can't come back. So this then leads to a lowered sensitivity to sound. Hearing can also be disrupted due to congenital abnormality of the ear or by age-related changes. One major possible disorder is tinnitus. It's a major age-related disorder of hearing that causes a perception of sound in one or both ears in the absence of auditory stimulus. Tinnitus is relatively common age-related disorder, occurring in about 85% of individuals with hearing loss or hearing problems. This can occur in those with or without hearing loss and can occur in people of all ages, but most commonly occurs in older adults. So for example, if an older adult reports hearing a ringing or buzzing sound in their ears, but it cannot be interpreted to anyone else, this is what is known as tinnitus. These sounds seem clear, present, and real to the person experiencing them. However, they're only perceived by that affected person. It's thought to be caused by various factors such as medications, infections, neurological problems, and other hearing loss related disorders. Now, it's really important to know that tinnitus is not a life-threatening disease and it is highly manageable with proper care. To properly treat tinnitus, one should treat the problems related to the disorder. So for example, one should avoid loud or continuous noises. One can also avoid irritants that could aggravate or perpetuate the condition, such as alcohol, caffeine, chocolate, tea, anti-inflammatory drugs, aspirin, and quinine. Medications, self-help, and support groups are also available to help individuals learn about and manage their tinnitus. Individuals with tinnitus should also be taught about biofeedback, relaxation training, and stress management, and how these could possibly help their condition while developing and strengthening their coping skills. Moreover, hearing aids are an accessible and affordable option to those who have a hearing impairment, whatever that may be. These can be issued by a licensed audiologist after careful examination and after that audiologist diagnoses the degree of their hearing loss. Cochlear implants can also be discussed as well to determine if they are appropriate for the individual. These two options help amplify the sound through a mechanical device so that it's easier for that person to hear and get a second chance of hearing how they heard before all these hearing loss occurred. And these are my references. I hope you've enjoyed.